From the late summer and over several months, we conducted a survey of members of the National Lipid Association, as well as other cardiovascular groups. We had 434 people who responded to the survey, and it's important to point out that there was no compensation for any of these people who responded to the survey. Of those who responded, of the 434, most were physicians, practicing physicians, and prescribing lipid-lowering therapy. Most were lipid specialists or cardiologists. And we found some important information of the survey. First that we found is that our respondents were working hard to get patients on current guideline therapy as related to lipid-lowering therapy. And they tried to maximize and get these high-risk patients on high-intensity statin therapy. And we specifically asked them about patients who are very high risk, those who have clinical atherosclerotic vascular disease, either coronary, carotid, or peripheral arterial disease, or those who have FH familial hypercholesterolemia. And they really tried to get these patients on high-intensity statin therapy and follow clinical guidelines. The problem is they also reported that as a barrier and obstacle to getting these patients on high-intensity statin therapy was the issue of statin intolerance, most commonly muscle-related symptoms and other side effects from statin therapy, and that limited their ability to get these patients on high-intensity statin therapy and in turn achieve the LDL cholesterol goals that they were driving for based on clinical guidelines. But they tried hard, and on average, they tried at least 3 statins in different doses before identifying a patient who was statin intolerant. For those patients who are on a maximally tolerated statin therapy, they then would choose adjuvant therapy, and then after that, in order to achieve the LDL cholesterol goal that they wanted in clinical practice, they would then consider choosing a PCSK9 inhibitor. And again, we were happy to see how they followed clinical guidelines with regard to lipid-lowering therapy of maximizing the statin dose, adjuvant therapy, and then considering a PCSK9 inhibitor. So what I want to talk about next now is the challenges that we saw and what our respondents identified in being able to prescribe a PCSK9 inhibitor.